Testing is considered a bedrock strategy for all countries during the COVID-19 pandemic. Recognizing this, countries across the world have vowed to ramp up testing capacity by increasing the number of test sites, the capacity of their laboratories, and the number of contact tracers. But how much testing is enough? Is there some metric we can use to assess whether our country is doing enough testing? It turns out there are a number of key indicators that can help us answer that question. The problem is that it can be difficult to judge each of these metrics collectively, especially if, for example, they are moving in different directions. Each country has its own context too, such as the level of development in their health system, how transparent their government is, and how widespread the outbreak is locally. As just one example of the many factors that will affect the testing capacity, countries in conflict cannot dedicate sufficient resources to testing and timely reporting of data. So what is the most reliable indicator to tell us a country is testing enough? How can we standardize these different indicators so that they can be comparable across all these different contexts around the world? And is there some way to combine them into a single number so we can easily compare countries and track progress? I set off with a colleague of mine to answer these questions. In the end, we put together what we called the COVID-19 Testing Index, or COVE-TI. Our paper has been submitted for publication and is under review. We've posted a preprint, which is our draft version of the report that is being peer-reviewed, and I'll post a link in the description. Our goal in creating COVE-TI was simple. We wanted to create a single comprehensive metric that assessed whether a country was testing enough. Most importantly, were they actually detecting most of the infections? The challenge for us was in estimating how many infections were being missed and undetected. In computing this new metric, we also wanted it to be possible to compute it for any country or territory in the world. Therefore, it needed to be based on a relatively simple set of data that is generally reported by every country on a daily basis. We based everything on only 6 pieces of data: cases, or the total number of people who have officially tested positive; deaths, the total number of people recorded with COVID-19 as the cause of death; recovered, those reported to have resolved the disease without death; active cases, population, and the number of tests performed. Every one of these 6 values is found for more than 200 countries and territories across the world on the Worldometer website. Using only these data, we can compute several key epidemiological indicators that feed into our COVE-TI. The first is the case fatality rate. The case fatality rate is simply the proportion of resolved cases, those that resulted in either a recovery or a death, that have resulted in deaths. It is not the number of deaths divided by the number of cases, because not all cases have resolved. Some people are still sick in the hospital, and we don't yet know the final outcome of those active cases. The reason case fatality rate tells us a lot is because we know that generally around 1%, or slightly less, of all people that are infected will die. We call this the infection fatality rate. So if the case fatality rate is higher than 1%, we know we're missing infections. Once the case fatality rate is 2, 3, 5, or more %, then we are missing a lot of infections and only identifying the severe cases that result in death. Case fatality rates in many of the hardest hit countries are as high as 8% in Egypt, 13% in Sweden, 14% in Mexico, 15% in Spain, 26% in France, and even 36% in Yemen. We can be sure that in these countries only the severest infections have been identified as cases. The second key epidemiological indicator we looked at was the test positivity rate. The test positivity rate is simply how many of the tests have returned positive. Let's talk quickly about what testing is and why it's so important in an infectious disease outbreak. For COVID-19, we generally use nasal swabs to collect mucus and cells from the nasal and throat areas, which are sent to a laboratory. There, a technique called PCR replicates and amplifies any virus cells so that they can be detected in the sample. Testing is important because if someone tests positive, they can be instructed to isolate from others, which helps reduce the number of transmissions. Additionally, anyone that person may have been in contact with during the infectious period, which begins prior to the onset of any symptoms, can be identified for testing through contact tracing. When testing is conducted thoroughly and results returned promptly, the transmission chain can be broken and the epidemic can subside. Testing capacity is considered adequate when the test positivity rate is less than 10%, and even lower at less than 5% is better. If the test positivity rate is higher than 10%, it means we're only testing those that are clearly sick and are very likely missing the mild or asymptomatic infections, which means we aren't breaking the transmission chain. Many countries are using these very indicators to gauge their response, but we still don't know how many infections are going undetected, possibly perpetuating the outbreak without even knowing it. So in our research, we use these two key indicators together, along with some other factors that adjust for a country's health system capacity and the government transparency, to estimate the detection rate, or percentage of infections that have actually been detected. A more robust and adequate testing regime will result in a higher detection rate, perhaps as high as 50% or more. Coupled with isolation and contact tracing, a robust testing scheme and high detection rate will substantially flatten the curve, even without a so-called lockdown. So, which country is doing the best? Our new metric COVE-TI answers that question, and I'll show you the results soon. But how does it work? We made COVE-TI to be a scale from 0 to 100, with 0 representing the worst and 100 the best score possible. It's based on a combination of 4 indexes. We give a weight to each subindex and add it together. The first index is the detection rate index. Higher detection rate is better, so that gives you a higher index score. The second is the test positivity index. High test positivity is bad, so a high percentage gets a lower score. The third is case fatality index. High CFR also scores lower on the scale. And the final index is the active case index. It's based on what proportion of the cases are still active. So if a country is in the throes of an outbreak, this percentage would be high and their index score would be low. The detection rate is the most important component of the COVE-TI, so we give it more weight, 40%, while the other 3 get 20% each. So, who are the winners and losers? As of August 11th, the top countries or territories in the world, according to the COVE-TI, were Iceland, Malaysia, New Zealand, and Singapore. Many of these countries have been recognized for their success in responding to the pandemic, with a robust testing program such as South Korea, Hong Kong, and Australia. In these countries, they are likely detecting 1 in every 3 or even 1 in every 2 infections. On the other hand, some of the hardest hit countries across Europe and the Americas were not able to ramp up their testing enough in response to the size of the outbreak and have lower COVE-TI scores. In these countries, they may have found only 1 in every 10 or even 1 in every 20 infections. When we look at how the index has changed over time, we see that the scores have generally ranged from a minimum of about 15 to a maximum of about 85. Some countries have recently seen their index drop as an outbreak developed, such as what happened in Australia's city of Melbourne. Other countries have seen steady values as they've maintained a proactive testing regime, including South Korea and Germany. And some countries were substantially overwhelmed at the onset and have been progressively improving testing capacity to meet the size of the outbreak, as seen in the U.S. In summary, testing is an incredibly important tool for breaking the transmission chain of infectious disease. It's important to remember, though, that the level of testing needs to be scaled appropriately for the size of the outbreak. Many countries are performing incredible numbers of tests, but it is still not sufficient to proactively stay ahead of the transmissions. Our COVE-TI allows us to gauge whether it's enough. Another key point is that test results need to be returned rapidly, with a turnaround time of 1 day ideally. And testing needs to be coupled with contact tracing and isolation. If you'd like to read more about our index, I've put a link to that preprint manuscript in the description. Let me know what you think in the comments below. If you like this video, check out some others on other public health topics. Be sure to subscribe to receive future videos, and as always, thanks for watching.